Do you frequently feel like your heart pains sometimes? Or maybe your child seems to get tired very fast, even after a small walk or playing. Have you noticed pale skin or unusual bruises without any injury? These might just seem like normal things, but sometimes they can be signs that the body isn't making enough healthy blood cells. That's where Fanconi anemia comes in. It's a rare disease that mostly starts in childhood and affects how your bone marrow works, the soft part inside bones that makes blood. Without enough good blood cells, the body can't carry oxygen well, fight infections, or stop bleeding easily. Imagine your body being like a car with a weak engine. It runs, but not smoothly. That's what life can feel like with Fanconi anemia. So what causes Fanconi anemia? Think of your body like a big instruction manual made of DNA. This manual is passed from parents to kids. Sometimes, small mistakes called gene mutations happen in the manual. For Fanconi anemia, kids must inherit a broken copy of certain genes from both parents. It's like getting two faulty batteries. The flashlight just won't turn on. These faulty genes make it hard for the body to fix damaged DNA. DNA damage happens every day, from sunlight, chemicals, even normal cell activity, but healthy bodies fix it fast. In Fanconi anemia, the repair system doesn't work well. Over time, the damage builds up, especially in the bone marrow, leading to serious problems. Now let's talk about how you can tell if someone might have Fanconi anemia. Have you seen a child with arms that are shorter than normal or missing thumbs? Or maybe they're much smaller than other kids their age. These are common physical signs. But inside the body, the problems run deeper. Because the bone marrow isn't making enough blood cells, people with this disease often feel very tired due to low red blood cells, catch infections easily due to low white blood cells, and bruise or bleed a lot due to low platelets. Imagine trying to run a marathon with half a tank of fuel. That's everyday life for them. Some kids may seem fine at birth, but start showing symptoms by age 5. Others may have kidney or eye problems too. The signs add up, and if many are present, doctors start asking questions. First, they ask about symptoms and family history. Then they do blood tests, like checking the oil in your car. If blood counts are low, they might suspect bone marrow issues. But the key test is the chromosomal breakage test. Here's how it works. They take some of the person's blood cells and add a chemical that damages DNA. In healthy cells, the DNA fixes itself. But in Fanconi anemia, the DNA breaks apart easily like weak paper tearing when you fold it. That test confirms the disease. Now for treatment, there's no magic pill yet. The best cure right now is a bone marrow transplant, replacing the broken blood factory with a healthy one from a donor. It's like swapping a broken engine for a new one. Until then, patients may need blood transfusions or medicines to help manage symptoms. But transplants are risky and not always possible. Can Fanconi anemia be prevented? Not exactly. Since it's caused by genes, you can't stop it once a baby is born with it. But families can take steps before having children. If a couple has a child with this disease or knows it runs in their family, they can talk to a genetic counselor, like a guide for DNA questions. The counselor can test both parents to see if they carry the faulty gene. If both are carriers, each child they have has a 25% chance of getting the disease. Think of it like rolling 2 dice, trying to avoid double sixes. Some couples may choose IVF with genetic testing to pick healthy embryos. That way, they can grow a baby without the broken genes. It's not stopping the gene from existing, but it helps avoid passing it on. Scientists are not giving up. One exciting area is gene therapy, fixing the broken DNA instructions inside a patient's own cells. Imagine editing the faulty page in the instruction manual and putting it back in the body. Early trials show promise. Doctors take the patient's stem cells, fix the gene in the lab, and return the healthy cells. No donor needed. Another area is new drugs that help cells survive, even with DNA damage. Think of it as adding a backup plan to the body's repair crew. Researchers are also studying why some people with the gene mutations don't get sick. Maybe they have helper genes we can learn from. These advances give real hope, not just for longer life, but for better quality of